Hi there, my name is Taylor Chatwin and I am a chiropractic student at Parker University. So I'm here today to talk a little bit about the benefit of chiropractic as well as the collaboration that can happen between chiropractors and other healthcare professionals. This collaboration not only promotes patient health and wellness, but it really gives the patient a well-rounded approach to feeling their absolute best. So, a little bit about the basics with chiropractic. It is a healthcare discipline focused on the diagnosis, treatment, and prevention of disorders related to the musculoskeletal system and the nervous system. So, chiropractors are very focused on those systems, and that's kind of our bread and butter. That is the specialty. Whereas if you went to a podiatrist, they're focused on foot health. If you went to a surgeon, they definitely know, depending on the type of surgeon, they know a lot about exactly what they're doing. If you went to a dentist, they're focused on oral health. So it really just depends on the different healthcare profession that you're in, what they specialize in. So I think that's important to note, is that each one of us specializes in something different. And that means that when somebody comes into our office presenting one way, we might not actually know how to best help the patient, but we probably know who we can refer them out to. So the key benefits of chiropractic, first and foremost, is pain relief. So many people go to the chiropractor for pain relief after an accident, after a fall, or really just maybe they slept weird and they tweaked their back. The problem becomes that this misalignment or subluxation that they're facing is causing them pain. And so they go for pain management and an adjustment. So that is first and foremost what people go to the chiropractor for most of the time. Next would be improved mobility and function. So when you have this subluxation or misalignment within your body, and particularly your spine, there is definitely limited range of motion. I don't know if you've ever been one to go to turn your head and you feel like you can't turn it anymore because you slept weird. That is the idea. So chiropractors work on improving that range of motion and that overall mobility of the joint. And so that is key in chiropractic offices. So finally, there's a lot of preventative care and making sure that our body is free of these subluxations, which causes communication disturbances throughout the body. We have this innate intelligence that we are born with. It's a philosophy of chiropractic that when these subluxations happen, we remove this innate ability for our body to heal, or just a natural way for our body to heal. So chiropractors work to prevent that and remove any subluxations that might be disturbing this communication system. So if we look at some examples of how chiropractors and other healthcare professionals could work together, we might see that primary care physicians may have somebody who comes into their office and they really have gnarly back pain. Something happened, maybe there was a trauma, but there's no fracture, and something's just wrong. So they may be able to refer to a chiropractor in order to work on some of that musculoskeletal system and see what's going on. You could also have an orthopedic surgeon, per se, where as a chiropractor, if we see a fracture, we might send our patients to an orthopedic surgeon, whereas if an orthopedic surgeon is all done with, any type of surgery for the patient, maybe they refer to a chiropractor after to just restore that nerve functioning, make sure everything is working right, make sure there's free of any subluxations, things like that. Another example may be that physical therapists and chiropractors work in a very close tandem. While physical therapists are really working on strength and movement of the muscles and things like that and joints, chiropractors focus on the alignment and the nerve functioning. So those two work really well together, back and forth, referring to one another. So these professionals and various professionals alike can work together, starting with both mutual respect and communication. When chiropractors and medical doctors are speaking to one another, it's always with a privacy intent for their patient's security and safety, but also so that they can best help the patient and give them the most well-rounded care possible. We're moving away from one type of healthcare, and I think that the ultimate collaboration of all of these various healthcare professionals, we will see the best benefit for our patients. So that is the best idea for me, I believe, for chiropractors and other healthcare professionals to work together to best support their patients.